Go.
My name's Anissa, and this is my head to toe assessment. So first, I would provide privacy and perform hand hygiene. And I'm going to come in and say, knock, knock, knock. Hi, my name's Anissa. I'm going to be your nurse today. I'm just going to do a full head to toe assessment on you. It should take about 20 minutes. Could you please verify your name and date of birth for me?
Ryan Miley, 6'1", 93.
Okay. What are you coming in for today?
The checkup,
And do you know where you are?
doctor's office,
Do you know what day of the week it is?
Friday.
Okay. Are you currently in any pain?
No,
And are you allergic to anything?
no.
Okay, so my patient is alert and oriented ×4. He's sitting upright. He has no signs of acute distress. His mood is happy. His facial expression is smiling, and his speech is precise and clear. Next, I would do vitals, which would be blood pressure, heart rate, respirations, temperature, and oxygen saturation. Now I'm going to look at your skin. So just looking, the color and tone is appropriate for race and ethnicity. I'm just gonna feel. So it's warm and soft. Just looking, he has no signs of lesions, no wounds, and no incisions. I'm gonna look at your fingernails. So nail beds are pink. He has a capillary refill of less than 2 seconds, and no clubbing is noted. So I'm gonna look at your head. Just on inspecting, he has no lesions and no infestations. Now I need you to close your eyes and tell me when you feel touch.
No. No.
Okay, you can open your eyes. Can you smile? Can you frown? Can you raise your eyebrows, shrug your shoulders, and rotate your head bilaterally? Okay, so cranial nerve 5, which is trigeminal, 7 facial, and 11 accessory are all intact. Now I'm gonna look at your eyes. So just looking, there's no redness or discharge noted. So now I'm going to go ahead and look up for me. So conjunctiva is pink and moist, sclera is white. Just look straight ahead at me. Okay, so pupils are 3 millimeters. They're equal, they're round, they're reactive to light. And can you follow my pen light? And to accommodation. Okay, follow it again for me to do the cardinal field of gaze. Perfect. Okay, so cranial nerve 3, oculomotor, 4 trochlear, and 6 abducens are all intact. Now I'm going to look at your ears. So just inspecting the external auditory meatus, there is no signs of discharge. Sorry. No signs of discharge. And can you repeat after me?
Red shirt,
Okay, so based off the whisper test, cranial nerve 8, which is the acoustic, is intact. I'm going to do your nose, so if you can look up for me. So nose is symmetrical, there's no deformities, no inflammation, no redness, no drainage noted. Okay, and can you breathe out? And again. And he has bilateral patency. I'm going to look at your mouth. Can you open for me? Okay, so lips, tongue, and gums are pink, moist, and intact. Can you say ah? Can you stick your tongue out and move it side to side? Okay, and I would also use the tongue depressor to test the strength of the tongue and the gag reflex, which would indicate that cranial nerve 9, glossopharyngeal, 10 vagus, and 12 hypoglossal are all intact. So now I'm going to do respiratory. So just looking, no accessory muscle use is used. So now I'm going to listen to your lung sounds. Okay. And you can just breathe normally. So we're going to go right upper, left upper, right middle, and left lower, and right lower. Okay, now I'm going to do the posterior lung sounds. So left upper, right upper, left lower, right lower, left lower, and right lower. Okay, so all lung sounds are clear. Now I'm going to do the cardiovascular and peripheral vascular system. So I'm going to palpate your carotid arteries one at a time. Okay. Okay, so those have regular rate and rhythm, 2+ bilaterally. I'm going to do your radial pulses now. Okay. Okay, those have regular rate and rhythm, 2+ bilaterally. Your pedal pulses. Regular rate and rhythm, 2+ bilaterally, and then his posterior tibialis pulse. Okay, and those have regular rate and rhythm, 2+ bilaterally. So if we were in a hospital, I would elevate the head of the bed to a 45-degree angle, have you turn your head to the left, and there's no JVD noted and no edema. Now I'm going to listen to your cardiac sounds. First with my diaphragm of my stethoscope. So aortic, second intercostal right sternal border. Pulmonic, second intercostal left sternal border. Erb's point, which is third intercostal left sternal border. Tricuspid, fifth intercostal left sternal border, and mitral, which is also where the apical pulse is, fifth intercostal midclavicular line. And I'm going to do the same but with my bell. So aortic, pulmonic, Erb's, tricuspid, and mitral. So all heart sounds are clear and no murmurs were noted. Now I'm going to do your abdomen. So if he was in a hospital gown, I'd be able to see a little better, but it's symmetrical and contour is round. So I'm going to listen to your vowel sounds first. So we're going to go right lower, right upper, left upper, and left lower. Vowel sounds were normal active. Now I'm going to palpate them in the same order. So right lower, right upper, left upper, and left lower. Did you feel any pain? Okay, so no tenderness or distension is noted. Now I'm going to do the musculoskeletal system. So first I'm going to inspect your elbows and just feel. So contour is smooth and they're symmetrical bilaterally. Wrists are contour is smooth and symmetrical bilaterally as well. Now we're going to do range of motion in your elbows. So if you go do this for flexion, extension, and hyperextension all the way back. Okay, pronation and supination. Okay, so he has full range of motion bilaterally in his elbows. And then for your wrist, flexion, extension, and hyperextension. And he has full range of motion bilaterally in his wrists. Okay, so hold your arms out again for me. Don't let me push down. Don't let me pull up. Okay, so he has a muscle strength of 5. Now I'm going to look at your knees. So contour is smooth and they are symmetrical bilaterally. And ankles, contour is smooth and symmetrical bilaterally as well. Okay, so now we're going to test range of motion for your knees. So I need you to stand up for me. Okay, do right leg flexion, extension, hyperextension. Okay, left leg flexion, extension, hyperextension. Okay, you can sit back down for me. So he's got full range of motion bilaterally in his knees. Now your ankles, right ankle, you're going to do dorsal flex up, plantar flex down, eversion out, inversion in. Another one. So you're going to dorsal flex up, plantar flex down, eversion out, inversion in. So he has full range of motion in his ankles. Okay, so kind of lift your legs up off the ground. Okay, don't let me push down. I'll do pull up. Okay, so he's got full muscle strength of 5 in his lower extremities. So I'm going to do sensory function. Close your eyes for me, and I need you to tell me when you feel dull or sharp, okay?
Sharp. Dull. Dull. Sharp.
And inhale.
Sharp. Dull. Sharp. Dull.
Alright, so he has full sensory function in his upper and lower extremities. Okay, so now I need you to stand up, take like 3 steps toward me, and back. And he has an even, steady gait. This concludes my assessment for today. Again, are you in any pain? Okay, and I would put the bed in the lowest position, locked, side rails up, call light within reach, would thank my patient, thank you, and perform hand hygiene.